force, has visited 7 out of 12 regions and interviewed frontline staff. I'd love for you to hear the stories about how our folks are out there working hard. That, you know, they have little support. They've got flip-top telephones. You know, they go into places and try to take kids out of homes. If you don't take them out of the homes, you get criticized for taking them out of the homes. If you take them out of the homes, you get criticized for taking them out of the homes. I mean, we met with the police chiefs yesterday, the retired and the active police chiefs. They understand exactly and want to help us, and we're enlisting their help. But I'd love for you to listen to those sometimes. We're creating a new death review process. It's headed up by Dr. Modell, and we're moving healthcare up to a priority in that department. We're going to, the thing we're going to be looking at every day is safety. These kids are safe. The second thing we're going to be looking at is whether they're healthy or not. It's a huge, I mean, the second thing we do probably in life is maybe we think about, but we've got to be healthy. We've got to get our health right. We don't pay enough attention to health care in children's services, and we're going to get that to where it needs to be. And we're working with the DCS staff. That's going to be moved up to a new level under my leadership. It's never been that way before. And we're also on court to meet that 90-day deadline for creating a new death review process through Brian A. And the reason we are is because we've used these two departments to collaborate to get it there. We're ready today to start getting input. And I think we delivered to Judge Shookoff last night the first review of the new death review process, which is required of us for the court. We've appointed a new director for the DCS central intake. We've developed and received approval to complete the TFAX amendments, which is $1.2 million that this administration through Larry's help has been able to move forward and get us this money now to where we can improve this TFAX system. I've arranged a meeting with consultants from Cadre 5 in Knoxville, and they're working with DIDS and DCS to move up our systems, and they've helped the federal government do great things, and if they can help us, we sure want them to help us. The advocacy groups that we're working together with the two departments, we have a really good advocacy system set up at DIDD. We have 3 people at the department to answer questions and try to help people. We've got to improve that. I mean, families get distressed when they're trying to find help and they can't find it, and people have a backlog of services to do. So putting these groups together and coming up with ways that we can help each other has been a huge success for us, Mr. Chairman. Dr. Tom Cheatham, who heads up our health services at DID, is working with Dr. Gatlin at DCS in the area of children's health. We've approved early deployment of the 13 attorneys that I told you about. I've announced job shadowing. We're going to have everybody at the central office and everybody out there in an administrative position, and whether you're an accountant or a secretary at DID, you're going to go see what it's like to be on the front lines and have that experience, because I think that you'll have a lot more sensitivity for what those people out there on the front lines have if you've had that experience. And I'm telling you something, Mr. Chairman, we've got the lowest paid people in state government out there right now making decisions, life and death decisions out there in the field. They have very little pay, and it's not a very good job. We can increase the pay. We can, increase the pay here. But we've also got to make that a good job again. I mean, we've got to put on a second shift in Memphis where we need one. We've got to do things like that. And I've announced that, and I visited the G4S facility, which there's been some question on. I was impressed with it. It's located at Clover Bottom. I've established a new initiative that public policy at DCS will be reviewed by providers, and there'll be an open forum, and we'll pass it out, and we'll have a public hearing on it before we pass policy. Providers are going to know what the department's doing before they just pass it out. I've made a decision, and we just got word this week, which is big. We're going to get involved with accreditation and pursuing that with the Council on Accreditation. You know, that might not make you great, but it'll put the systems in place to make you great. And whether you want to or not, then you'll have the systems in place. And it's nationally recognized, and it'll help us with the courts. It'll help us with the advocates. I've also worked with Human Resources and Larry Martin to address our vacancies here, especially in Davidson County, where we're going to move it up kind of like we did the attorneys. We've got a terrible problem in trying to hire people, and of course we've got vacancies we've got to wait on. But if we can move some people up to get ready, we can take care of this huge turnover that you've got in some of these counties. It's as much as 25%. So if we move them up, getting ready to hire them, it's not going to cost any money, but we can get people ready to be hired and put in place quicker. And I think that'll be a huge help to people that are out there saying that we've got a vacancy here and we're waiting for 6 or 8 weeks to get it. You know, the great thing about team is that, you know, it's going to be performance-based. But one of the things it's done is expanded the broad base of applicants that you have. That's going to be helpful in the long run, but in this situation, we need to get people deployed faster. Brenda Clark from Civil Rights is going to be working with our initiatives at DCS, and you know, with our diversity people at DCS. Dr. Modell and Dr. Cheatham will be acting in dual roles as deputy commissioners of DCS and DIDD. Someone asked me, is that going to cost more money? And I just kind of laughed when I told them that, because we all know that they're going to be merging talents to create that resource. 2 huge talents. We're bringing back some other staff that was not currently there. All in all, Mr. Chairman, after just 3 or 4 weeks on the job, I think we're setting in pretty good shape to move forward. And let me tell you one other thing, and then I'll keep my mouth shut. The estimated average lifetime cost for a victim of non-fatal child malnutrition is $210,000. I'm not talking about someone that's lost their life in custody or someone like that, but I'm talking about every time that a child is mistreated in this country and it becomes a mental or a physical issue, the cost to society is $210,000. And if you look in 2008, the cost to this country and children that had difficulties and were not treated right is $124 billion. And with the drug culture we've got, you know, we're going to have to run hard just to keep up. And if we don't do something about the drugs on the front end, Mr. Chairman, we're going to be spending all the state budget on this. Well, thank you very much, and we'll be glad to answer any questions.
Thank you, Commissioner. Let me start. My daughter's worked in juvenile services in the county level for 15 years or so. And it's great to hear about the phones. We're getting these phone calls handled. I know you talked a little bit about iPhones, and they should have iPads. And what happens so much of the time is that we have these caseworkers walking around with files on everybody. Nothing's on the computer. Case numbers are not on computers. That person, the caseworker, is gone on vacation for 2 weeks. No one knows where that file is, what's going on. And I see this over and over again. And I'm glad that we're doing the phone system. But I think we need to, these people in the field, if they have a problem, should be able to, right then, it doesn't matter, taking a picture, downloading the file, uploading the file. I think this is so important because we're losing so much time when we're looking at some of these things that, you know, 48 hours, 72 hours you know, and there's no reason in the telecommunication world we have today that nothing should be done, you know, within 24 hours. And, you know, if you get an email at 8 o'clock in the morning, 12 hours later, you should be able to answer that email. It doesn't matter if I'm sending a supervisor or a supervisor send it down to me. I don't, and I'm saying this from personal experience, that if we don't, not personal, but stories I hear, if we don't handle this, we're going to be, I guess we are a little better. I asked a question of the commissioner going back about 12 years ago, did you know where every child is? And the commissioner said, yes, I know where every child is in the system. And I said, excuse me? And he said, yes. I asked him, yeah, I wasn't going to do it in the full committee. I walked off and I said, you call me back next 12, 24 hours, tell me where his child is. He called me and said, what do you know that I don't know? It shouldn't be that way. This is what, I think this could be a great department. I think we could save a lot of children. But yet, on the other hand, I think we have to do things differently than we've done for the last 10 years. And I'm not trying to preach, so please, don't take it that way, but I think there's things can be done. No different we go into a county system and you ask the lawyers that are handling some of these cases, they said they don't want to handle them because they don't want to work Department of Children's Services. So you have lawyers, but you don't have probably your best lawyers on some of this time. And the time process is so frustrating to people, and it's no different than stories we've read in the last 60, 90 days in the paper. It wasn't about a process, but it was about a timeline. And, if I have to carry a file back down to headquarters or back to a field office, when I should be able to push a button and download that file instantly, as a supervisor, you as commissioner or assistant commissioner can see that file. I think this is going to solve, if we get into the 21st century communications, I think this is going to solve a lot of these problems. So, thank you for indulging me. Speaker Pro Tem, Deputy Speaker McDaniel.
Thank you, Mr. Chairman, Commissioner, thank you for your hard work and dedication, that of your staff. I want to look at the, under the, make sure I'm getting in the right order. Under the hotline calls, you discussed here today, the number decreased slightly for some reason, I guess, from one year to the other. Am I looking at this correctly?
Which slide are you on?
I'm not on a slide, I'm
Oh,
on
okay.
an information sheet. But the point being that of those calls that are coming in, 36% of the calls, according to the information I have, are referred to the multiple response system. What about the other calls that aren't referred? Could you just describe what kind of calls they may be and what informational calls or
about 36%, as you said, go to multiple response. Another 37 are what are called screened out, and that means that either the call was not really, as Mr. Martin said, they may call in, inadvertently to get information about where to get child care or something like that, or the allegation is not sufficient that it rises to the legislative mandate of abuse or neglect. And then another percentage does actually go down what is called the investigative track. And those are usually the more severe physical and sexual abuse cases.
The number of children in custody has increased recently, about 566, is that correct? What's caused this, do you think?
Well, as Commissioner Henry said, in the last year, we have seen an explosion of drugs, primarily in the eastern part of the state. Knoxville has just seen a dramatic increase, and especially with drug-exposed infants. So we've just had a very, we're part of that larger society. And when those kind of community events and tragedies happen, we're right there involved in it. So that's been the primary issue, is the drug babies and the other drug-exposed children coming in.
Commissioner, is there communication between the DCS and law enforcement agencies because it's being brought out here?
I think there's very good communications in some counties, but in some counties there isn't. I mean, if you look at Memphis, for instance, all of this team is set up in the same building. They talk to each other. The district attorney